Erie County felt it important for us to get out in front of the issue of the swine flu that's certainly being reported on in Mexico and New York City. And I think for the public in Erie County, we need to emphasize the fact that there are no reported cases of the swine flu in Erie County. People at home can rest assured that if the threat were to arise, we in Erie County are better than most prepared to deal with this issue. Right now, we're standing in a lab that is one of only 30 nationwide that is equipped to identify the swine virus. We're very lucky to have this technology in Erie County because we have and are one of the best prepared counties there are, whether it's this type of emergency or others that we've faced. We should also emphasize that the swine flu appears to be sensitive to some treatments, and that the treatments work best if they're initiated within 2 days of the symptoms showing up in patients. The lab we're in right now puts us ahead of the rest of the nation for quick diagnosis of the swine flu. Our Health Commissioner, Dr. Anthony Billatier, will be speaking to you, has teams watching our local hospitals, even as we speak, looking for any signs of any patients that we might think could have the swine flu. At this point, I'd like to invite Dr. Billatier to go into more details of what we're doing here in Erie County. Doctor.
Thank you. Thanks, County Executive. I, too, would like to thank the media for being here and introduce perhaps an enhanced role for the media. This is a very quickly evolving situation that requires lots of communication between the health department and county government and our citizens and agencies in the county. And we have no quicker way to get messages out than through the media. And so for responses like this, you not only are the reporters, but you also are partners with us. You're a great tool for us to use. And so I thank you and hope that you'll continue to be partners with us. I mentioned this will evolve before our eyes, and so is our planning. It's a work in progress and will remain so. And so what I tell you today may be different tomorrow. But let me tell you a few things. First of all, I'll talk quickly about what swine flu is. I assume that most people have already heard that, but I'll just give a brief overview. Then I'll talk very importantly about what we would like the public to do and not to do. I'll talk about what we're doing, and then finally I'd like to talk about what we would like other partner agencies to do, including local governments and various other entities, institutions, schools, healthcare providers. First of all, let me say, with respect to what swine flu is, it's one of many, many kinds of viruses that are all called generically influenza. And it's important to note that we still have regular old seasonal human influenza in New York State and across the nation. And so people still may be getting regular old human influenza. Now, fortunately, this year it's been a very mild flu season, and it's actually been a somewhat late flu season. But again, it's still flu season, although it appears to be winding down. However, that may create some diagnostic challenges. So when patients present with influenza-like illness, which means they may have a high fever, a dry cough, muscle aches, fever, chills, they could have one of many viruses, but if they have influenza, they may have just garden variety human influenza that we've seen a little of this year. They may also have swine flu. And one of the things that might be a little bit different, in addition to those symptoms I just talked about, people with swine flu sometimes will not just get lung symptoms, as I just mentioned, but they may get stomach and intestine kinds of symptoms, including nausea, vomiting, and diarrhea. And so that may be one of the diagnostic kind of questioning that will help distinguish. Most importantly, I think it's important to impress upon people, though, that if you have symptoms like this, what you need to do is you need to call your doctor and not to jump to conclusions. Right now, a person will not be considered to be a case or suspect to have it unless they not only have all or some of those symptoms and have some link to it. They have to have either traveled to an area where it's been found, Mexico, New York City, or some other area, or have had contact with somebody who has it. So somebody who's remained in Buffalo and has influenza-like illness symptoms won't be suspect for it. They should not be tested for it because right now we have no reason to believe they would have the disease. So in addition to contacting your physician, and that is, again, the first preference. If people think they're sick enough, they should contact their physician, and I can't stress that enough. We would also like people to continue to practice respiratory etiquette. We've used that term for a few years now, and it's good for all sorts of respiratory complaints, including the common cold, but also for swine flu. And that means if you cough or sneeze, do it into your elbow. Make sure that you don't cough or sneeze on others. Make sure that you wash your hands. Soap and water is a great thing to use. However, if you don't have access to it, waterless hand sanitizers are also very effective. If you're sick, don't go to work, don't go to school, so you don't give your illness to other people. This really is all just good common sense. And then finally, it's important that the public stay on top of all of the things that we will be telling them, that the CDC will be telling them, the State Health Department will be telling them, and we'll try to make it as little confusing as possible. This sometimes gets very technical. We'll try to distill it down, though, to understandable terms. Now, let me talk about what we in county government are doing. And behind me today, and he'll say a few words in a few minutes, is Commissioner Greg Skibitsky from the Department of Emergency Services. All county events like this, disasters and other major events, are coordinated by his department. In this particular event, the health department would be the lead department to fall under that structure. And as such, we've activated our incident command system. It's a very low level at this point, but we've basically assigned people various roles. They're engaged in planning. They're using the National Response Framework, if that means anything to people. And this is the same sort of system we use in all of our events, most recently Flight 3407. As part of this ramping up of our capabilities, we're taking plans that have been written over the past 7 years or so that have been created with the infusion of federal dollars through the state to the county. We have plans that we've purchased. We have equipment and supplies. We have people that we've hired. We've trained people. We've exercised. And we've done it all for this very kind of scenario. And so, as the county executive mentioned, we think we're very prepared. However, it's time now to take those plans, and plans are only a starting point. They get you to the door, and now we need to figure out the specifics of the situation and massage those plans so they meet the situation of the day. And again, as I mentioned, those will be works in progress. As things change, our plans will change accordingly. A large part of those plans include surveillance. As you heard the county executive say, right now we know of nobody with swine flu here in Erie County. However, the first step of that planning and response capability would be looking. And we do that every day. We do that anyway. We do what's called syndromic surveillance. We look for people who have common kinds of symptoms in common situations. And so, for example, if 2 people call us up and say they ate at the same restaurant 2 days ago and have the same sort of symptoms, we then suspect maybe they got something at the same place, and then we investigate. And so we're doing things like that every day. We're going to enhance that surveillance, though. In this case, a lot of the surveillance comes out of emergency departments. And so far, we're seeing no increase in the amount of people coming into the emergency departments or the amount of people complaining of respiratory or influenza-like illness symptoms. And so that's a good thing. We're also sharing this information with clinicians, with schools, and with others who need to know. And so if they notice a bunch of students who are ill, and that's essentially the scenario in one of the schools in New York City, as you've heard, then the health department went in and investigated. And that's the same in Erie County. Now, as I mentioned, should we encounter a patient or healthcare providers encounter a patient who meets the case definition, and again, that's not only do they need to have the symptoms and be sick, but they need to have some sort of link. They have to have traveled to Mexico, traveled to New York City, had contact with somebody who has been diagnosed with swine flu. In that case, we will be entertaining calls from physicians to do some culturing, to do some, it's a simple swab test that's placed in the back of the patient's nose, and the sample then is sent off for laboratory testing.